Can Indians staying abroad consult with you and your team during COVID situation? How does one do a meeting online, and what tests are required for a virtual meeting? What safety procedures are met for a mother to conduct a successful treatment at your facility during this difficult situation? Can NRI freeze their eggs in India? Does the procedure allow them? So basically what we spoke about, but they want to know more about what your hospital
so now with regards
steps
to
taken.
As per the current situation of COVID, see, the only thing is that with whatever limitations we can, definitely there are certain steps, like at every point of the entry there's a person who looks into, checks from where this person are there, whether there is a fever, history of fever. Now the thing is that we'll have to trust what the patient says. Now that is also if the patient had a fever and hides it from us, we cannot. So, but then if there is an issue like that, we always have a segregation point. We take them to a different room and a scan is done there, a consultation is done there. If there is an issues there, we always, anybody who's coming from abroad, we have a provision to do a antigen testing. So we have all those provisions at this point of time. Otherwise, at every point of time, yes, all people are using personal protective equipments. We are using this thing. Regular cleaning is happening. We try to the seats. See, now the thing is that when it is a very busy day, probably how much ever we tell the patients social distancing, there are limitations to which we can force them to do. But we have at least kept those seats blocked in between to prevent people from sitting with each other. So other areas, well ventilated areas. So probably in the hospital, these are the things that we actually are following.
And the treatment also is provided for a mother once she becomes pregnant and she does unfortunately get COVID. Is that something that is also taken care of?
That is again important thing that people should know. Like, see, while during the process, now there are several times whether they become COVID during the treatment, when they are pregnant, are all different scenarios. Now, if the patient is actually before the treatment, if you are doing an IVF, before the start of the treatment and before the egg retrieval, there are 2 points of time we do COVID testing twice in these patients. So that, but the thing is that because they end up having COVID in the second, sometimes you will be negative first. If it is positive first, we can always postpone the treatment to a later month.
Oh, you started this procedure?
Yeah, it's been a while. It's been a while. I think from the last, it's been like that. So we are doing the test 2 times because the test validity is only some 3 or 4 days. So we do it again at the time when the eggs are ready. See, when the eggs are ready, we always give them that option because we really don't know at this point of time how it can impact on the oocyte quality, how the baby is affected, etc. So at that point of time, we give them an option to cancel because we've only done that much. Only the stimulation has happened. We've not done anything else. So if these 2 situations, they realize that they are positive, at that point of time, we cancel it or postpone the treatment. This is what happens during the stimulation. Now, because now the problem comes if they become pregnant and they have become COVID positive. Now the challenge here is that because ours being a very high risk pregnancy care center, we have a lot of patients who come are very high risk care. So even when we are actually, we will not be able to entertain COVID patients because then the other patients will also get affected. So in a lot of these COVID patients, what we happened in the time is we always refer them to a COVID care center, and during that COVID care center will hand them over, like, because majority of those patients might not really have symptoms. They'll be only taking basic treatment from them, and once they become COVID negative, they come back to us. That is what generally has been happening. Very rarely or 1 or 2 patients who have had actually gone and had to deliver there also, because they became COVID when they come for a delivery, when they came for a cesarean section. So any cesarean section, we do an RT-PCR to realize whether they have COVID. Because see, the thing is that it is just not about the doctor or the staff. It is about the patient goes to a post-op, it goes to a theatre, there's a closed system, you have air circulating system. So when you're taking this orals, we should have an infrastructure which has an isolation for all these specifications. To be very honest, our hospital is not that equipped to do a isolation unit for COVID patients also. So we can do the basic care. I should be honest with you. Like, so we can do the basic. The basic care can be given, but beyond the basic care, it becomes difficult to do everything because our 80-90% of the other patients will get paranoid because again they don't have another choice because they are those they are coming to us for difficult procedures, or they are coming to us for bigger procedures. So they don't have any other place to go to.
But they can contact you online, they
Yes,
can
yes,
write
yes,
to
yes,
you,
yes,
they
yes,
can
yes,
email,
yes, everything,
all
yeah,
that.
all that communication. We
Virtual
actually, now we have virtual video consultations. We have audio consultations. We are giving all these options. Like I said, somebody wants to consult us, we can fix a time of a video consultation. We give them time. We write down what is given. We discuss. So actually, I feel that has helped a lot of patients, not just in COVID, but I think probably it will help patients in future who are staying abroad, so that they can plan their trip.
Yes.
What happens is they'll come here and then they realize, okay, no, husband
like
need not had come this early.
Yeah.
So it's time for him to go back.
Yes.
But the treatment is only after some time. So I always tell you, if you are able to consult somebody like that, it becomes easier.
Okay.
So that you can plan your treatment and come.
Okay.
Because whatever may be the reason, the treatment is all on the female partner.
Yes.
And the female partner is who is required here for a longer time.
Yeah.
So the husband is not able to come, he can schedule his visit according to the time of when the major treatment is happening, so that he can reduce his leave and things like that.